Hello, this is Dr. Lewerenz at Longevity Health Institute. I hope this finds you well, and I hope my information is brought to you to bring you even better, more informed, more educated, more into your body and functional, personalized medical approaches, and making you healthier. And as you've heard me say before, thriving, not just surviving. So I want to talk to you about several things today because there's a lot of clinical aspects that happen today that I think are very key. In listening to these longevity updates, if you will, is going to be very key, even if you're not our patient here at Longevity Health Institute, even though we have room for you. We're welcoming and happy to have new patients. Me and my practitioners are always accepting new patients. We have a full concierge program. We have a full integrative medical program. We accept insurance. Not all insurances, but we accept insurance, and I keep our fees, and I try to be as reasonable as I can with that in our difficult insurance world, as you all know out there, because it helps you and it keeps paying it forward and passing it along to help others. And that's my mission, okay, to do well. So here's my my take-homes that are very, very key, okay? So even if you're listening and you're not our patient, please take these caveats, share them with others, friends, loved ones, family, and even then bring those to your health practitioner that you see, your internist, your family doctor, etc., because this is really things where you can gain traction and really get improvements in your overall health and wellness and solve some things, not just get my refills, going in, complain at the doctor, I'm tired, I'm fat, I'm sick, I get this, I get that all the time, okay? Because it can stop, and it can stop now. But you have to have the right approach at looking at, functionality and how things actually really, really work in your body, okay? And understanding that. And it doesn't have to be rocket science either, okay? So some basic things is this, because it was really, really key. And we're seeing some improvement in somebody that her entire life is actually had, and that is inflammation. So one of the key indicators of inflammation in your body is your CRP. So if you have been tested and have a CRP, okay, or an HSCRP, it's a highly sensitive C-reactive protein, and it's high, and we don't like it anything above 1 or 2, but if it's 5, 8, 10, 25, 30, believe it or not, last week I saw somebody, but there was a reason for it being 150. It tells us that there's a big immune inflammatory fire burning response in your body, okay? And it has to be identified, corrected, and tracked so that CRP comes down. Because I will tell you, if you have an elevated CRP, you have something brewing in you that is bad. Whether it's a cancer, whether it's an infection, whether it's autoimmune disease, whether it's a bad imbalance in your gut flora and inflammation at the digestive lining, whether it's your weight and obesity, blood sugar, you name it. But there's something that is not identified in you that has to be identified and then not just corrected, but that has to be tracked, because whether you band-aided or you medicated or treated the problem, if that CRP is not coming down and you're not being tracked to get that CRP down, okay, that is the goal to get you well and healthy, and that cannot be overlooked or bypassed. Super, super key, okay? So CRP. Patient today is at her CRP up in the 50s. When we saw her, she actually came in, and she was actually a patient a few years ago, and she admits, did real well, got sloppy, gained weight, stopped some supplements, etc., and approaches, and gained her weight back, and got sick often, bronchitises and respiratory and allergy things. Had a few episodes the last few years that were related to respiratory conditions and sinus and allergies, and just knew, hey, I got to get back in, see Dr. Lewerenz and Longevity Health Institute, and get back on track. So when we caught her CRP was 30. It's down under 20 now, and we've only done a few months of some work, and she's losing weight in that. But her condition and issue wasn't just one thing. So you can have a high CRP with weight gain, not typically that high, not in the 30s. But she had bad underlying digestive issues, and she just dealt with it. Food sensitivities, irritable bowel. Yeah, I eat this and it's bad for me, and I take that, and but it helps, but I get sloppy with my diet and what have you. And she just deals with a hoarse voice, reflux kind of stuff, not technically heartburn, but like we call it dysphonia when you talk and you have a raspier, graspy voice. And she was just dealing with that, a lot of clearing of her throat. But this is a sign of reflux. So she had bad digestive health. She had her weight that she gained, okay? And I also believe, which she's not even aware of, because she never had one complaint that she's aware of complaining of anything related to hormones, but she's postmenopausal and is very low hormonally, estrogen, progesterone, testosterone, and DHEA. She's prone then to inflammation because she has no anti-inflammatory hormones on board. But put on the brakes. This is all we did at first. We got her diet right. We got her on the right supplementation and replenishment for her gut health and gut lining to heal it, okay? And we got her on the right diet and movement, calorie burning, to lose some weight. So she's already lost about 14, 15 pounds, and her gut's doing a lot better and feeling a lot better. Immediately, the clearing of her voice and dysphonia on that and the raspiness has gone away, and now her CRP is under 20, and that is our goal. Now, our goal with her is to obviously get that CRP even lower. I think it's going to take more weight loss. It's only been 2 months with her, so more time on healing the gut lining, okay? But she will do wonderful. We haven't even touched hormones. So we discussed it today. I went over the results with her, but you cannot live, I don't care if you're 50, 55, 60, you cannot live postmenopausal with very low hormones because it creates a prone inflammatory condition, okay? And one thing that happens if you live long enough is you're gonna dry up, you're gonna inflame, and you're gonna stiffen. And I'm gonna tell you, that doesn't sound good, does it? I don't want it. I don't think you want it. And if you already feel this, you need to come see us, because that is not a way to live. And I mean, when that's what happens in your body, in everything from your joint to your arteries to your brain, okay? Everything. And that's why we have this kind of disease condition and end up with a lot of these conditions that are very, very mean, if you will, as we age. So remember, we want to thrive, not just survive. So I think that's very important. Get your CRP tested, get your CRP tracked, understand and make sure your doctor or practitioner is explaining to you why you have it, okay? And it's identified, not just treated and here's a drug, okay? So that's story one. Story two on our, if you will, our longevity update, okay, is I have a patient that is 80, very healthy, but 80, and has had on and off reflux, heartburn, never had any lower GI issues or symptoms. And we do our normal stuff with him, genetic screening and hormone balance and nutrition, and he lives half the year down in Florida and very happy and healthy, very active, works out, has a young wife and keeps very, very active in life and happy with his kids and traveling, etc. And he developed, and he's unaware of, and maybe it was just some sloppiness with his diet, he said, but bad diarrhea, bad digestive stuff. Because of his age, down in Florida, he went and he got scoped, and he had what they told him was a lymphocytic colitis. And because he had, upper and lower, he was scoped in his EGD, an endoscope into his stomach, and they said that he had bad reflux and what looked like the start of even some cellular changes that we start to call Barrett's esophagus, that has to do with changes in the cellular lining in your esophagus that is precancerous, which that is scary. I tell you, if there's a cancer that should scare you, it's gastric and stomach cancer and esophageal cancer, because that's a terrible way to die, terrible way to suffer and die. It's very painful. You can't eat. So not to deflect and get too on a tangent there. But anyway, so he had some changes here that kind of were just out of nowhere a bit in his explanation. Probably thinks due to just kind of some bad diet and things like that he got kind of a little bit off track. But he's also 80, so being fair, he's got a colon, an esophagus, and a stomach, and epithelium in there, and columnar cells that are in there that are essentially, and let's be real, 80 years old. Okay, so anyway, what did we do with him? Well, I just did a follow-up with him, and he's doing wonderful. He's in Florida, so we just did a telemedicine. But in 3 months period of time, he has been re-scoped, and he is digestively no changes that in his esophagus that look like precancerous, totally healed. He has no symptoms esophageal. His bowels are regular. He said literally, quote unquote, 100% better. Okay, and when they re-scoped him, they couldn't tell he had any, in 3 months, any colitis. Okay, now granted, I think he didn't have this going on for a long time. He had symptoms, they caught it early, he's 80, so they were aggressive, I was aggressive, and I'm gonna tell you what we did and what's really key, and I'm gonna tell you it never fails, and it's a little bit more aggressive step that we take with gastric health and gastric healing, but I want you to know about it, okay, because that's how effective it is. So of course in him, what did we do besides he got his, his screening and testing and some of his care down in Florida. He did come back here once, and then again he got, like I said, re-scoped back in Florida and got his results just recently that were very, very positive and healed. But what did we do? So in that 3 month period of time, okay, he was put on initially by his gastroenterologist, to be honest and fair and full disclosure. He was put on some antibiotics for the lymphocytic colitis. We put him on high-dose probiotics that we use here, multi-strain, using ones that have Saccharomyces boulardii. You can get these on our website or on our shipping department through Carewell. Call our office or watch another video and it explains that. But you want to use high-grade, multi-strain, live probiotics, and I always like to use with any yeast or infectious or inflammatory condition a type of probiotic that is called Saccharomyces boulardii. I put them on immunoglobulin IG26. It's an immune protein, if you will, powder that has the ability to regenerate and de-inflame the gastric lining. And I used a common amino acid called glutamine, L-glutamine, and high-dosed a couple times a day for him so that he started regenerating and have the ability to get some mucosal regeneration. So not just de-inflammation and treatment with creating a better biome and creating better gut flora, okay, that ultimately also helps him be less inflamed, but using things that help him heal at a cellular level, okay? Now, because he's 80, and because this was kind of out of nowhere and so serious, that I put him on what are called peptides. And this would be a little bit more aggressive. It's not our first line therapy. But again, this is somebody that had something pretty shocking and pretty significant. And I wanted to make sure we didn't waste time. Again, he's 80 and he had scopes, and it was, something not to mess with when you're dealing with anything precancerous, okay? We put him on a peptide that's called BPC 157. It's an amino acid chain peptide that is wonderful, has excellent Eastern European studies in healing ulcers, preventing gastric inflammation and ulcers from NSAIDs and Motrin and stuff like that, but is very anti-inflammatory and healing to the digestive lining, particularly, okay? And again, it has studies on this. So it is an injectable, very small subcutaneous injection into the belly fat 3 times a week. But the use of that he only used that for 2 months. In the 3 months, again, with that protocol, and I guess I didn't mention cleaning up his diet, which was already really good. But the one thing he was doing is getting a little bit worse and bad with gluten. So we really reiterated, get gluten out of your diet, clean up your diet a lot better. And with this approach, not only is he feeling much better and not having any symptoms, but both upper and lower scope were perfect. So I think that says a lot for a functional, regenerative approach to somebody that, yeah, he'll have to be scoped again in a year and make sure things are really good. After that, probably never in his lifetime, I wouldn't think, unless they find something, okay? So that's really important. The other third thing on our longevity update, okay, is that we all want this. And this is even me. We're all, watching our weight and keeping weight off and trying to maintain weight or lose weight. This is super key. I see this here all the time, and it's the one caveat that someone, told me today that they're doing, and they actually thanked us for it, and they're like, look, that wasn't that hard, and you kind of made it make sense, and it really, really, really helped them get on the path and see some traction here with weight loss, okay? You've heard me say this before. Weight maintenance and weight loss is always this, and it's three things, and that they're not that complicated. They are, but they're not really that complicated. Hormonal balance. Your hormones, all of them, got to be balanced, got to be right. You got to appreciate where you're at hormonally for weight maintenance and weight loss. Your calories, macros, calories, micros, calories in and out. What do you burn? What do you take in? These all matter, okay? You cannot eat 3,000 and burn 2,000, even if it's healthy calories, and think, oh, I'm going to be okay. It's not going to work, okay? The other thing is part of your metabolism is your gut flora in your liver, how you detox, how you methylate, how you get rid of toxins, and how hormones go through your liver, how well your liver functions. But new studies show too, what's connected to that is your digestive gut flora, okay? These are all super, super key. Now, part of this, and what this patient brought up to me, and I was really encouraged by, because they told me that it worked and it made a big difference. We're working on all these hormones, detox, and their diet, calories in and out, okay? But one thing I had them do is move. Sounds simple, right? But move. And what me and our nutritionist here, who's an excellent coach, Victoria, and an excellent mentor, and keep you accountable and put you on a personalized dietary and nutritional plan, okay? Because it is always personalized. It's not vegan, paleo, it's not Mediterranean. It's what works for you and what's creating the best health for you in a personalized approach, okay? But one thing that she did and that I endorsed and did, and I think that's super key, is you need to move. You need to move your body. We cannot get a metabolic change if we're sitting behind a computer all day, or sitting behind a phone, or sitting at a desk, okay, 80% of our day. And then we go home and sit on the couch, and then we go to bed and sleep. It ain't gonna work, okay? Yes, can you lose 5 pounds, 7 pounds, 10 pounds? Absolutely, but you're not going to get significant weight loss if you're not moving. That stays, okay? So I said, look, you deserve, I'm talking to you, you deserve to care and treat yourself well. You deserve 45 minutes to an hour a day for you. And in that, carve out something you can do for 45 minutes to an hour every day, Monday to Sunday, no days off. Now, it doesn't have to be that hard. It could be walking. If you're not used to walking, walk on and off, walk a few blocks, take a break. That's easy, walk 45 minutes, but whatever you can get in exercise in 45 minutes to an hour, okay, every day you need to do. Obviously, if that's easy and you're used to exercising, you do the same amount of time for you every day, but you carve out that 45 minutes to an hour every day because you deserve it, and you then have to ramp it up. So if it is walking, you're going to walk at a faster pace just so you can get more distance in and more intensity in that hour. And if it's something like, I already work out and I ride a bike and I spin or whatever, in that hour you're going to get more distance and more effort in that hour, okay? And you can mix it up if you're already working out and going to the gym and you're already motivated, okay, and you're doing HIIT training or whatever, fine. 2-3 days a week, do HIIT training, do higher intensity, but get in more than what you've done in the past that's maybe easier, and you get it in that hour, okay? And yes, mix it up. You're not going to do HIIT every day. You do HIIT training and high intensity 3 days a week. The other days, just go on walks. Get it in an hour. That's all you need to do, okay? If you swim, same kind of thing. Instead of swimming 30 lengths in an hour, okay, your goal is gonna be to get 50 or 60 in, okay? But all you have to do is exercise and move your body for that hour, okay? We need to do that to change your metabolism, change your metabolic rate. So that we're really affecting something, and I'm telling you, we'll see traction. This work for this patient today has reported over 20 pounds of weight loss in about 6 months. But everything, she feels great, hormones balanced, diet good, inflammation down, pain down. She's doing wonderful, and she's doing a lifestyle that honors herself and really says to herself, I deserve this. You deserve this. You deserve to be able to move your body and be active 45 minutes to an hour a day, okay? Even if you're busy with work, husband, wife, kids, family you're supporting, I get it. I live it. I get it, okay? But you deserve and need to carve out a time to support you so you can support them. And if you're coming from a good place, like I hope we all are, you're supporting many and you're sharing love and you're passing it forward, etc., okay? But you need time for you so you can be the best you can be for everyone else. And that's true love. Self-love is true love for others. Think about it. So anyway, longevity's update. I know it's a long one. Hope you learned a lot. Share with others. We're always open here for you. Dr. Lewerenz and myself and my providers are here for you. Alex, Shannon, Lauren, Victoria the nutritionist, our IV nurse Naomi and Mary. So we have a wonderful team. My front desk and staff are amazing. We get great reviews. Our customer service we're proud of. My MAs and nurse practitioners, we're a very happy, supportive team, and we love what we do, and we're here for you. So give us a call, look us up online, longevityhealthinstituteinc.com, follow us, and if you can't see us, we do telemedicine, but if you even don't need or feel like you need to come in, at least follow us on YouTube and Instagram, because we continue to bring you, advances in scientific, evidence-based medicine that is personalized. Dr. Lewerenz, be well.